What is anemia? It's defined as a low number of red blood cells. In a routine blood test, anemia is reported as a low hemoglobin. Hemoglobin is the main protein in your red cells. It carries oxygen and delivers it throughout your body. If you have anemia, your hemoglobin level will be low. If it is low enough, your tissues or organs may not get enough oxygen. Certain forms of anemia are passed down through your genes, and infants may have it from birth. There are many types of anemia. All have different causes and treatments. Some forms aren't a major concern, but some types of anemia may be severe. Symptoms. The signs of anemia can be so mild at first that you might not even notice them, but if your condition gets worse, so do they. Symptoms generally include dizziness, fast or unusual heartbeat, headache, pain including in your bones, chest, belly, and joints, problems with growth, shortness of breath, skin pale or yellow, cold hands and feet, or tiredness and weakness. Types of anemia. Anemia caused by blood loss. Anemia caused by decreased or faulty red blood cell production. Anemia caused by destruction of red blood cells. Risk factors. A diet lacking in certain vitamins and minerals. A diet consistently low in iron, vitamin B12, and folate increases your risk of anemia. Intestinal disorders. Having an intestinal disorder that affects the absorption of nutrients in your small intestine, such as Crohn's disease and celiac disease, puts you at risk of anemia. Menstruation. In general, women who haven't had menopause have a greater risk of iron deficiency anemia than do men and postmenstrual women. Menstruation causes the loss of red blood cells. Pregnancy. If you are pregnant and aren't taking a multivitamin with folic acid and iron, you are at an increased risk of anemia. Conditions. If you have cancer, kidney failure, diabetes, or another chronic condition, you could be at a risk of anemia of chronic disease. These conditions can lead to a shortage of red blood cells. Slow, chronic blood loss from an ulcer or other source within your body can deplete your body's store of iron, leading to iron deficiency anemia. Family history. If your family has a history of an inherited anemia, such as sickle cell anemia, you also might be at increased risk of the condition. Other factors. A history of certain infections, blood disease, and autoimmune disorders increases your risk of anemia. Alcoholism, exposure to toxic chemicals, and the use of some medications can affect red blood cells production and lead to anemia. Prevention. Many types of anemia can be prevented, but you can avoid iron deficiency anemia and vitamin deficiency anemias by eating a diet that includes a variety of vitamins and minerals, including iron. Iron-rich foods include beef and other meats, beans, lentils, iron-fortified cereals, dark green leaf vegetables, and dried food. Folate. This nutrient and its synthetic from folic acid can be found in fruits and fruit juices, dark green leaf vegetables, green peas, kidney beans, peanuts, and enriched grain products such as bread, cereal, pasta, and rice. Vitamin B. Foods rich in vitamin B include meat, dairy products, and fortified cereals and soy products. Vitamin C. Foods rich in vitamin C include citrus fruits and juices, peppers, broccoli, tomatoes, melons, and strawberries. These also help increase iron absorption. Complications. Left untreated, anemia can cause many health problems such as severe fatigue. Severe anemia can make you so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia may be more likely to have complications such as premature birth. Heart problems. Anemia can lead to a rapid or irregular heartbeat. When you're anemic, your heart must pump more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Causes. Anemia occurs when your blood doesn't have enough red blood cells. This happens if your body doesn't make enough red blood cells. Bleeding causes you to lose red blood cells more quickly than they can be replaced if your body destroys red blood cells. Treatment. Anemia treatment depends on the cause. Iron deficiency anemia. Treatment for this form of anemia usually involves taking iron supplements and changing your diet. Vitamin deficient anemias. The treatment for folic acid and vitamin C deficient involves dietary supplements and increasing these nutrients in your diet. Anemia of chronic disease. There is no specific treatment for this type of anemia. Doctors focus on treating the underlying disease. If symptoms become severe, a blood transfusion or injections will be applied. When to see a doctor? Make an appointment with your doctor if you're feeling fatigued and you don't know why. Fatigue has many causes besides anemia, so don't assume that if you're tired, you must be anemic. Some people learn that their hemoglobin is low, which indicates anemia when they donate blood. If you're not told that you can't donate because of low hemoglobin, make an appointment with your doctor.